Good afternoon and welcome to Virtual Face-to-Face with President Bruce Jarrell. I'm Alex Lukowski, Executive Director of Media Relations. On wall calendars and offices all over campus, it still looks like March 2020. But after what seemed for so many like an endless pent-up pandemic year, we are almost there. And in less than a month, we will begin to return to campus in force. Of course, some of us have been coming to UMB from time to time as work demanded, and others never stopped coming every day because their work on campus never stopped. But whatever your situation, for all of us, it's going to be a transition. We certainly all have a lot to be proud of. Through everything, we've maintained excellence in education, research, clinical care, and service to the community. And we have a lot to be thankful for. Our work, our jobs, and our community endure, thanks to everyone's hard work and the university's commitment to the safety and well-being of everyone who works here. Call it family friendliness or flexibility, if you like. And even though we miss seeing each other, collaborating and innovating together, in some ways, it's that flexibility that we enjoy is what's probably going to be one of the things that makes it a little bit harder for us to come back together as a UMB family. But that is what we're here to talk about today, our plan to return to campus. In March this year, we all received the UMB Recovery Framework, an outline of how we're going to do that. And the most important points were reiterated in a letter from Dr. Jarrell delivered into our email boxes this morning. This summer, starting June 1st, each school or unit or entity on campus is expected to begin the process of returning to about 50% density. That means at any given time, about half of the people who work in an office will be here working on campus. And by the time classes begin in August, the target is 80%. As the letter said very simply, starting June 1st, almost everybody needs to be here some of the time. And when the fall semester begins, almost everybody will be back on campus most of the time. It would be understandable, of course, if many of us who read that letter today focused only on the timeline, but there are two other very important points. First, a commitment to balance between work and personal needs, and that includes, quote, a level of flexibility unlike what we had previously. The letter also reminds us that the university's aggressive health and safety policies have worked. We've never had a significant outbreak on here. I should probably knock on wood. Our staff who've been working on campus have shown how physical distancing and the proper use of PPE can keep everyone safe. For the last year, our environmental services team has maintained a high level of cleanliness. I see them every time I'm in the office. And a great deal of thought has gone into developing guidelines, standards, and practices for working safely together on campus in larger numbers. And there is also the matter of vaccination. Right now, more than 70% of our employees and 68% of students are already vaccinated. And the university system has mandated that everyone be vaccinated prior to the start of classes in the fall. Joining Dr. Jarrell today are a few of the people who've been doing the work of maintaining a safe environment and preparing for our return. Juliet Dickerson is the Interim Associate Vice President for Human Resource Services. Melissa Moreland is the Director of Operations and Maintenance, and Denise Meyer is Associate Director of Environmental Services. I want to remind you that this program is being recorded and will be posted on the UMB homepage, umaryland.edu. And a little later in the program, you'll have a chance to ask your questions. I suspect we'll have a few. Just look for the chat button at the bottom of the screen, select Chat with Host, and write your question there. If you want to remain anonymous, that's okay too. Just let me know that and I'll try to remember. Now, please welcome our host, UMB President, Dr. Bruce Jarrell.
Thank you, Alex, and for all of you in the audience, thank you for being here. When we first started these face-to-face discussions, one of the things I said to Alex is, what's the limit of WebEx? And he says, don't worry, we'll never get near it. It's over 1,000. Wasn't that the number, Alex?
That was the number. It's 3,000 now, though.
3,000 now.
We have bumped it up, so we're in no danger. Don't worry.
Now, having sat through 30 or 40 of these over the year, I always pay attention to how many participants there are and sort of judge what the level of interest in a particular topic is. I see we're still going up. We're at 620 now, and that doesn't include Facebook and later views as well. So I know the interest is really high in this. And I know that we won't be able to get to all of your questions. We'll do our best to reserve the last 40 minutes for questions, which means we'll keep the talk ahead of time to a lesser number. The way I would like to start out is, first of all, we did send a letter out this morning. It is the way that we plan to move forward. And I just want to start by saying our concept that we gave you before about using the word family friendly, we're using a more inclusive term, and that is that we want this to be a university that enables work-life balance. That's a more inclusive term, but the concept has not changed, and I hope that it will not change. So for our discussion, we'll maybe get into that a little bit. The second thing is many of our policies and procedures are very much dynamic at this point, and we don't have answers, and we don't have all the input we need either. So I would say input will be very important here. The third thing is a comment that I made yesterday to the group of vice presidents and deans, and that was a quote from our former Secretary of Health, Mr. Robert Neal. And I won't give you the whole quote, but basically the message he was sending was, look, everybody is trying very, very hard here. We won't get everything perfect, but it won't be from lack of trying. Everybody's going to try hard, and we're continuing to be in that situation. We're going to try hard to get you the answers to these important questions that I know each of you needs to live by in terms of the next 6 months. So with that, I'd like to go ahead and ask our three participants to make comments. And I'm going to start with Miss Melissa Moreland first. So Melissa, the floor is yours.
All right, thank you, Bruce. So I first like to say I'm honored to be here, and I want to let you know that our staff has been here the entire time. So while we did reduce our staff to about 50% at the beginning of the pandemic, we did continue a presence on campus. We continued to properly maintain the buildings, all of the systems for the building health and safety of our occupants. And then as research and other capacities started to ramp up, we had to return. 100% of our technical staff returned and have been on campus since July. We do know that the buildings had low occupancy, so we went through all of the buildings. We flushed all of the water lines. We made sure that there was fresh and clean water. We had done a full review of the design and maintenance and the filtration systems in all of our buildings to make sure that the filters that we were using would meet the codes. We do regularly review all local and federal regulations and standards, and we can tell you that the filters in all of our on-campus research and admin buildings do meet or exceed those codes. In addition, we are still regularly maintaining, regularly changing all of those filters. We've provided plexiglass shields at our guards desks as barriers. So as you're entering the buildings, there will be a barrier between you and the security guard. We've helped building managers design and post signage. So you'll see signage as you enter the buildings that require masking and physical distancing. And you'll also see the capacity limits on elevators. I know elevators is a big question, and I'm sure it'll be discussed a little bit later, but I want to let you know that the University Health Group has relaxed capacity limits on our elevators. Elevator rides are typically much shorter than 15 minutes. Everyone is required to have a mask on. So they will be relaxed to about a 2 to 3 foot capacity so that we don't have to worry about waiting for a very long time for an elevator. Of course, we do ask for patience and when you're waiting. And then all of those new capacity limits will be posted before our return on June the 1st. But we have staff on campus. We're happy to welcome you all back. And if you need anything from us or we can do anything, just please let us know.
Thank you. I'm sure there'll be questions. Next, I'd like to ask Denise Meyer to make a few comments about her environment.
Thank you, Dr. Jarrell. Again, my name is Denise Meyer. Hello, UMB. I'm happy to be here, and I'm very excited to represent our environmental services group. These are the folks that provide pest control, custodial services, moving and recycling, and our grounds crew across campus. And thank you all to the essential workers across campus who have been here from the beginning or had rotated on or off and are back here on campus now and have been for some time. This has been quite an endeavor, and I appreciate everybody's partnership in that, especially with the EVS group. If you hear me say EVS, that is just short for environmental services. I wanted to start off by saying that the EVS staff were here on campus in the beginning of the pandemic doing biweekly rotations similar to that of O&M and Melissa's group. The pandemic started happening. However, we needed to return to campus. We had to be here to support research, clinical, experiential, and other campus needs across the university. So the staff has been back since July 100%, and I appreciate all of them and their efforts. Additionally, we're in constant contact with the University Health Group, and we're reviewing the CDC guidance and any of the university health guidance that comes down from the campus to make sure that we're adhering to the needs and the requirements of the campus and to keep it clean. We're here to help keep a safe and healthy campus and support everybody's well-being. The CDC confirmed that there's a lower risk of surface transmission of the COVID-19 virus through common touch points. However, we are committed to on a recurring schedule and based on frequency of use, providing enhanced cleaning throughout all of our buildings. Some of the changes that we've made in the environmental services have everything to do with the services and the tasks that we provide around the campus. We now use an EPA approved for use with COVID-19 disinfectant. The disinfectant can be used in a variety of ways. It can be used with what we call a handheld sprayer, a larger rolling sprayer for areas like auditoriums, and or a traditional spray bottle with a microfiber cloth. So you're going to see our technicians with these things as you come back to campus. We're also using disposable color-coded microfiber towels for our cleaning tasks now, and that's to reduce the risk of cross-contamination. We've enhanced our restroom and cleaning and disinfecting procedures. We are committed to disinfection after the initial cleaning using that EPA approved disinfectant. We also use our color-coded microfiber towels in the restrooms, and they're going to be serviced twice daily at minimum. We've also added the addition of a high touch point disinfection and cleaning to our daily and routine services across campus. A lot of those areas you're going to find in elevators, stairwells, entrances and exits, and common areas like your kitchenettes, break rooms, and waiting areas across campus. Again, we're following the guidelines and the regulations to keep everybody healthy and safe on campus. Additionally, I wanted to talk about some things that you guys can do to help assist us in cleaning and preventing the spread of this virus. From an environmental services standpoint, the custodial perspective, employees should use what we're calling the POU or point of use carts. These are blue carts that are made available throughout the campus. They provide cleaning and disinfecting products to assist with keeping health and safety measures intact in classrooms, offices, and conference rooms. Instructions for use of these carts and the products that are provided on the carts are available in each cart. And the building managers in the facilities across the campus are going to be responsible for helping make sure that these supplies are replenished and additional carts are ordered as needed. When departments are in unique settings, like the clinical, dental, or childcare areas, the cleaning and disinfection and hygiene procedures that are provided there are specific to those areas, and we'll work in conjunction to make sure that we're meeting those needs as well. We encourage, obviously, everybody on campus to wash your hands frequently to prevent the spread of COVID-19. And if it's not feasible, use those sanitizer stations that Melissa mentioned previously. All of these bullet points and these information pieces that I've shared with you are outlined in the UMB Return to Campus Guide, and I suggest that you take a look at that whenever you have a chance. Again, the EVS department has been here alongside other essential workers, providing these necessary services to ensure that you are safe when you come back to campus. See you in June.
Thank you, Denise, for that. Alex?
Can I just jump in because it has to do with what Denise was talking about? Sharice Singleton is asking if the cleaning includes microwaves and ovens and things like that in the kitchens, which never get wiped down.
So environmental services consider the handles of the microwaves and the whatever instruments or I guess equipment you have there. The microwaves and the refrigerator handles are definitely part of high touch points in those kitchenette areas. Yes, they are. The
Okay,
insides, I was going to say the insides are something that we would coordinate with your building facility manager.
Understand. All right, thank you. I just wanted to, that just was germane to what you were talking about. So.
Okay, great. Thank you. Juliet?
Hello, everyone. I'm Juliet Dickerson. I'm the Interim Associate Vice President for Human Resources, and I'm pleased to be able to share information with you today. We in Human Resources are committed to our continual support of the campus and the various needs to return us back to campus. For staff, we continue to offer wellness, work, other programs that hopefully are helpful as you make preparations to return to campus. We've done programs related to resiliency. We've got some more programs coming up, and I strongly encourage everyone to root the elm and take advantage of those programs. We are also in Human Resources offering some sessions that will be directly targeted to supervisors because we recognize that the return to campus effort requires different thoughts and communication for supervisors than it did when a large sector of the campus was sent out on telework. And so we're doing some targeted communication and open forums for that group as well.
Juliet, people are having a little trouble hearing you. Maybe standing or sitting a little closer to the microphone.
Okay, is this better?
A little bit.
Is that better? Sorry, can you hear me?
Yeah, we can. It's just a little lower than everyone. So as close as you're comfortable, that'll help, or picking up your voice.
Okay, I'll talk a little louder. How's that? Is that better? Okay. So, and then we will also be, I know one of the questions that has come up is what is the status of the telework policy, and it's currently being finalized. And I just want to remind the campus that starting through the summers until we hit our fall target date, that the current pandemic telework policy is still in effect. And so once we have the telework policy, the revised policy finalized, it will be shared with the campus. In the meantime, it has been shared amongst multiple groups on campus to receive input from the staff senate to the faculty senate, the leadership, and so that will be coming shortly.
Okay, thank you. And any other comments, Juliet?
No,
Gotcha.
I'll wait for the questions.
Gotcha. Now, one other comment that I would make is you all have heard that there's a vaccination mandate. We have not put parameters around that yet. There is very vigorous discussion about the mandate, about when it should take effect, how you get an exception, etc. We just do not have answers for that. But there is one good piece of information that I would certainly want to give you, and that is on our UMB campus. We know that at least approximately 70% of our faculty, staff, and students have been immunized. We expect our incoming students, the new ones, to be immunized as they get here. And when I say 70%, that's to the best of our knowledge, because we don't hear about everybody who gets immunized. So maybe I'd just like to make a brief appeal that if you've been immunized, please go into the SAFE system or some mechanism to let us know you've been immunized, because that's very important to us, even now before the mandate is in full effect. So Alex, do we have questions?
Oh man, do we have questions?
Oh man.
And a lot of them have to do with the vaccine mandate. Since you were just talking about that, I'll just throw a couple of these out so that you know what's on people's minds. One anonymous questioner asks about the specifics. You know, how do I file for a religious or a medical exemption? You know, what do I need to do? And another one writes that she's a member of the AAPI, the Asian American Pacific Islander community. She says, I'm deeply concerned about violence against our community during the pandemic. Several of my friends were confronted by people who wrongly believe the AAPI community is the reason why a lot of people are suffering. And their stories make me extremely uncomfortable, even when I go to a grocery store. And I'm concerned about my safety on campus during my commute. My work can be done 100% remotely. So is there anything that the university can do to provide flexibility for people like me? So these are a couple of examples.
Yeah, so I understand what you're saying, and we just have not finished all of the policies yet, so I don't want to give you an answer and then have to modify it for the future. I think a number of us are very aware of the Asian American insecurity right now and people not being appropriate in behaving with them. And the best I can say for the moment is our police force are on high alert on these issues. We will not tolerate that on this campus. So I'll have to leave it at that for the moment. But as we develop more of our policies, we'll try to address those things. So Alex?
Yeah, there are others who are asking about, there's always the devil's in the details, right? We talk about the density goals and limits, but then how do you measure that? How does that work? Let me bring in Brett Hassel, who has one of those sort of specific questions. Brett, are you there?
Sure, thank you. And thanks for you guys for being here. So, Dr. Jarrell, you know that we have a lot of summer programs, and Dr. Carey and I were super excited that the lab component is going to be in person this year. So the question relates to the extensive educational modules that are also part of these programs. And I may have answered my own question here, but should we proceed by just following the guideline of the 50% occupancy and then identifying space that will allow that to be met?
So Brett, first of all, nice to hear from you. And I think my general answer would be, and anyone who has a question about this kind of thing, if you submit really a proposal about your plans to us, that gives us, it gives Melissa Moreland's group a chance to review it and make sure all the proper precautions are being taken. But we want to encourage those kinds of things. I have from every school and every unit in the university, I now have a plan in general about how they plan to operate. Those plans look very good. We haven't done the final approval yet. Among those plans is certainly an increase in community engagement and our other community outreach kinds of programs. We want those to take place. Melissa's group needs to review them to make sure they're safe, but that would be our intention, Brent. Alex?
Okay, Mark Blazak is going to join us with another question about sort of timing and how do we make everything work out from a family-friendly point of view. Mark, go ahead.
Yes, I know I have two small children at home with me that are currently doing public schooling from home, and I was just curious, like, what type of considerations could be made, because their school year ends on June 22nd, and I don't have, with me being at home with them, I'm sort of watching them, so to speak, and while working from home. So I was just curious of if considerations could be made to adjust based on the end of school year.
Juliet, do you want to try to answer that loudly?
Absolutely. So can you all hear me? So what I would suggest is that first, the density numbers are the maximum. It's not that there's an expectation that every unit will be at 50%. So I think that's an important distinction to keep in mind, so that when there are situations such as the one you described, where you can work with your supervisor to work out a schedule and a return to campus plan that will work for your specific situation. We completely understand that all of the details of folks' lives haven't been worked out yet, and we want to absolutely be as flexible as we can, but keeping the spirit of returning to campus in place. And so the density numbers are meant to be a guide of what the maximum expectation is. That should give people lots of flexibility to work with their supervisors to come up with a plan that will work for their individual situation.
And I would agree with that. Flexibility is important here, and working with your supervisor to work through that, again, is equally important. Okay, Alex?
All right, we have an anonymous question. Someone wants to know, do you have guidance, or are you preparing guidance for in-person meetings and events and things when we do return?
Juliet, if you want to start on that, and then I'll add to it.
Sure. I know that there is a lot of work. I don't have all the details, but from the IT side of the house to evaluate our shared spaces in terms of having the technology that we'll all need. Again, this is all new for all of us, so to a certain degree, we're still determining what we will need. But the idea of shared spaces is being factored in with your leadership in your respective units and what that will look like. I'm not sure if
Yeah.
that quite answers the question, but
Yeah, and I'd add a few comments to that. First of all, the definition of physical distancing, that is the distance actually, I do expect to change over the summer. As many of you know, it did change for elementary and middle school under certain circumstances, and there are certainly examples of shorter distances being felt to be appropriate. One thing Juliet talked about was the IT considerations, and for the audience, we will be in phases where significant people are teleworking and significant people are coming into work. And we want to make sure that when we have an in-person meeting for those on campus, that those who are teleworking, i.e. remotely, will not be excluded, will not be disadvantaged, et cetera, in those conversations. So there's got to be a lot of thought to go into how do we have these hybrid meetings for the time being, so that everybody gets to participate the way they should participate. So I think we're going to be looking at that. And of course, finally, as more and more people get vaccinated, I think it's clear that it will get even more acceptable to do these in-person meetings. Melissa, do you have anything to add to that since you do those evaluations?
So I know that the University Health and Steve Deck and others are really closely monitoring and watching the guidelines. And as you said, some are already changing. We do expect some changes. So like I said, we've changed capacity in elevators. We're looking at classrooms and meeting rooms. So yes, as those updates are made, they will be communicated out to the campus.
And I would simply make a comment that Melissa and Steve Deck and that group have been exceedingly available and accommodating to make these evaluations and give us recommendations. So they have a lot of experience in this by now. So Melissa, I want to thank you all for doing that at the same time. Alex?
A similar issue is raised by a couple of people about, you know, in some offices and businesses, people have gone back, they put in plexiglass dividers. You probably saw even the legislature, right? They were in these plexiglass cubicles. Are we thinking about something like that? How do we keep people who are working in pretty tightly packed common spaces or cubicles, how do we keep them safe?
Melissa?
So we are not looking at plexiglass barriers. We do look at the cubicle spaces. We look at the distance between them. Right now, the guidance is that you do wear a mask when you're in your cubicle. So if there's not enough distance, if you're in open space, the only time where you're not masked is when you're in your own office with a closed door. Again, that guidance could change, especially as we all return to campus and with a vaccine mandate. But right now, we don't know who and who isn't vaccinated in office spaces. And so we are just requiring masking and physical distancing.
Great. Alex?
Melissa, they're just coming at you with more questions. So the other thing, and you knew this one was coming, is about air quality. And what can be done. We talked in schools, for instance, about, you know, increased filtration and turnover of air in buildings. What can you tell people about that?
So I can tell you, we've gotten this question a lot. We have done reviews. We have looked at everything. We are meeting or exceeding. We have at least, the recommendation is to have at least MERV 13 filters. Our pre-filters are at MERV 13. Most other filters our final filters are gasketed MERV 15 filters. So it's the highest we can do without going to HEPA filtration. We are not designed for HEPA filtration. It would overtax our systems. Increased ventilation isn't really going to increase the safety in our buildings. We're already exceeding. We have plenty of adequate air changes. It would actually increase ventilation, have a negative impact on our building health. We'd be bringing in extra humid air into the buildings that could lead to mold growth. In our research buildings, there's a very fine balance. It would impact our ventilation equipment, such as fume hoods and biosafety cabinets. It would impact the balance between laboratory space and non-laboratory space, and it would overtax our systems such as chilled water plants. So the increased ventilation rates as a blanket to increase safety really would have the opposite effect on our building safety and health.
Okay, Alex?
Okay, I'm going to bring in Charles Chalet, who has a question about snacks, I think. Charles, are you there? All right, Charles writes, now that we have events again, food and snacks, there's always food on campus, have always been a great way for people to come to an event or get people to come to an event and for them to share and talk. What would your advice be about offering food or snacks at events going forward?
So I can answer that. There is guidance that has been put in place for the summer for events. We do not have, again, for the fall, those guidance plans yet. But for summer events, if it is an indoor event, you can have up to 50 people as long as there are 6-foot social distancing and mask. But eating and drinking, unfortunately, is not permitted. And then outdoor events can have up to 100 people, and it would be the same restriction. So yes, I understand, and it's something, I've wanted to offer my staff as a thank you for being there and working through this, send them some, food or have a party, but right now, unfortunately, food at events is not allowed.
And we'll keep looking at those questions because, of course, the governor changed his position on this somewhat, and so we're listening to all of those things. But the other comment I would make is, remember, we have a whole series of committees, task force, loaded up with people who are interested and knowledgeable in these particular topics, and we don't take these actions without getting advice from a broad group of people that work on this campus and care a lot about this campus. So these are answers today. Today's May the 6th, I had to look. And we'll keep changing this as it comes along, and we'll keep communicating with you about it. Alex?
We still have a lot of questions about the telework policy. People are sort of trying to digest that. One person writes, these are all anonymous, does that mean that the current telework policy allowing us to work from home if we choose will be in effect until August? And another writes that she works in a research laboratory. She says 100% of our lab postdocs, student staff have been back since July 2020. We've been able to maintain physical distance in my lab because of our ability to work from home. How will the UMB return to campus affect people like me? Will our ability to work from home be protected? And then someone else says, could you just kind of summarize it again? It happened so fast. Maybe if you could explain how telework is going to evolve over the summer and into the fall, it would be helpful.
Juliet, you want to start with that?
Sure, absolutely. And so the expectation for the summer is that we will start returning to campus. The current telework policy, can everyone hear me, Alex, well enough? Not really. So I don't know what happened. And so the current telework policy for pandemic will remain in place through the summer until the fall. The revised policy will go into place in the fall, and all of the deans and the vice presidents have the revised policy. What will be finalized won't be much different, some minor tweaks from what was proposed as the revised policy. And they are currently working on their plans for their schools and administrative units for what telework will look like in each of the units.
So Alex, go back to your question there. What have we not covered, you think?
Yeah.
Well, there was the lab question about, they've gotten into a groove in this one woman's lab, and people have been able to work from home a lot, and it's been effective. And she wants to know if that's going to affect affect her?
So let me try, and Juliet can answer. The objective that we have here is to get more people back on campus through a transition period starting around June. So the idea is that we make this transition. It's not to make teleworking go away during the summer. It's to say we need to be hybrid, more hybrid perhaps than we were. But at the same time, the authority, the responsibility of the interpretation that our question asker had was that we have supervisors. We have people who are supervisors, and we have given them the flexibility to make these decisions in a reasonable way within certain confines. So we want more people on campus, but we don't want all of you back on campus. We're not asking for that. So I think this is an issue of reasonableness and talking with your supervisor. It's what makes sense. But remember, the objective is to get largely back on campus. So as we evolve, you need to be spending a little bit more time here and a little bit more time here. And all of us are doing that as well. Now, Juliet, what did I say wrong?
You got it, Dr. Jarrell.
All right, well, there is one aspect of vaccines that I think we should go back to. I'm going to bring in Elise Garcia-Baca, who brings up an important point. Elise, are you there?
I am, yes. Can you hear me?
Yes, go ahead.
Wonderful. Thank you, everybody, for having this today. This is helpful. I had a question because I've heard some rumblings of some staff and faculty not wanting to get the vaccine, not necessarily because it's a religious or that they are unable to get it, they just don't want to get it. And I'm curious if there is still going to be continued COVID testing for those people, or if they're, I'm not sure. I'm trying to figure out, like, how do the rest of us who have potentially been vaccinated, how do we continue to stay safe?
Well, and at least, maybe I misinterpreted your question, because another point of that is the people who can't, for an acceptable reason, can't be vaccinated. Are they going to be tested? Right. I thought that was part of your question. Is there, how will they be able to continue to work if maybe for medical reasons they can't get vaccinated?
Right. Yeah.
So I'm going to give you a partial answer, and I apologize if it doesn't completely get to your question. So if there's so we haven't decided yet how to make the decision, how to do the application process about exceptions to the vaccine mandate. But I'm assuming that there will be people who legitimately fall into the exception category, however that's defined, and therefore they will not get vaccinated. So your question is, how do we monitor the safety of those of us who are on campus who are vaccinated? And my comment would be, there will have to be ways to monitor those individuals. We haven't said what they should be yet. Obviously, testing is one of those, but there may be other solutions that our university testing and vaccination groups suggest that we can follow. So I think the bottom line is that we need to assure that for all of us on campus, it's a safe environment, and therefore those who are not vaccinated, there has to be some way to monitor that they're safe for us to be around as well. Now, there are many privacy issues and other issues around that, which is why I have to not give you a full answer until we have this fully vetted by the Attorney General's office and our own counsel. So there's many hoops that we have to go through before we can give you a final answer. For those who simply choose not to get the vaccine for not accepted waiver reasons, I don't have answers for you at this point. That will be a complicated discussion coming up over the next weeks to month. And undoubtedly that will involve the Attorney General as well as the University System of Maryland as well. So we've got lots of questions about that, just as you do.
Yeah, there are many questions, and people are questioning whether it's ethical to have a mandate, all those kinds of things. But there's one aspect of this that you addressed in your letter, but maybe it's worth talking about, which is sort of the reason why it's important to be back on campus. So we have an anonymous questioner who writes that first, she says, I appreciate all that UMB leadership has done to keep us safe and keep us working during the pandemic. But my biggest concern is that there seems to be this perception or an assumption that leadership must convince staff to come back and that staff can't be trusted with increased flexibility. I'm gonna shorten this person's question. I hope she's okay with that. She says almost every staff member that I've spoken with understands the need to be on campus in some capacity. We're a group of educators and experienced professionals. We love our careers. We just want to be acknowledged and trusted. Are there things the staff can do to better demonstrate our commitment to UMB? And our desire, and to show our desire for more flexibility and autonomy. So she's perceiving it as maybe people aren't trusted to do a good job.
Yeah, I actually don't accept it quite that way, and I'll try to answer this. I think our community has been exemplary in terms of how it's worked as a teleworking, as a hybrid education, in many different ways. I don't think this is an issue of trust. I think this is an issue of we're a university. Your in-presence counts on campus. It matters. Being here matters. And it's not just about your job duties. There are many things that you do here when you work here that set an example, that set a role model, that improve our network of communication among one another. To me, a vibrant in-person presence is better for this university. It's better for our students. Quite frankly, it's better for me to have people around me who I can talk with. And we've talked a lot about mental health. We've talked a lot about other kinds of health. This is one way to get back into a normal mode of operation. Now, Juliet mentioned the future telework policy. I'm going to tell you that telework policy is pretty flexible and pretty liberal. No, it doesn't mean that anybody can do whatever they want to do. There are supervisors and managers, and we have to work out what's the best thing for the university, and that includes yourself. But in the end, we're coming up with a pretty flexible work policy. I think it's more flexible than what I've seen around the other universities. So to me, we're trying to be very flexible. At the same time, I think it really does matter that you're here on campus to influence others. And I mean that in the best of senses. Now, that's kind of maybe the best I can do on this. Juliet, do you want to answer that, or any of our other participants?
Yeah, I think you hit the nail on the head. Can you hear me?
Yes.
Okay, I think you definitely hit the nail on the head, Dr. Jarrell, in that we are a vibrant community, collegial community, and we have very thoughtfully, in the revision of the telework policy, tried to incorporate the lessons that we've learned over the pandemic as it relates to telework. And so now we're at a point where our operational needs are changing. We're going to take what we learned over the pandemic related to telework and try to apply it as fairly as we possibly can, given the need to recreate a really collegial on-campus presence. And so we definitely hear you in that regard. Does that operationally, there's lots of, like Dr. Jarrell said, flexibility in the policy. Does that mean every request for telework will be supported by the supervisory or the leadership unit? I would never promise that, even before the pandemic. And so there will be lots of thoughtful discussions around how this will move forward. But we are returning to campus. And so with that in mind, we want supervisors, we want employees, we want everyone to really have these discussions really as soon as possible, so that we can, know what folks are asking for, and then move forward from there. But I think your point about the vibrancy of a campus community and an in-person experience really has to be a factor that, we couldn't consider during the pandemic, but we have to consider in a different way.
But Juliet, would you tell me if I'm making sense to you? If you look at the new policy and the expected number of people teleworking with the new policy versus the way we were 2 years ago, the amount of teleworking will be significantly more in the future. Do you think that's a fair statement?
Yeah, I do think that's a fair statement, Dr. Jarrell. And I think there's also a difference between what the policy says and allows and what operational decisions will have to be decided, what that will look like. But the policy definitely is more flexible. It's written from a perspective of support, whereas the pre-pandemic telework policy was written from the perspective of an exception and sort of proving why someone should be allowed to telework. And that's not the lessons we've learned over the pandemic, is that we want this to be, telework is not an entitlement. Large sectors of the campus were sent home because we had to manage a public health pandemic situation. But now that we're coming back, telework really is a benefit to employees, and we want it to be treated that way, and we want it to be thoughtful. But we are committed to an in-person experience as we begin our return to campus activities. And so there will be need to be some balance there.
Alex, why don't we keep going, knowing that I haven't completely answered this until we get the new policy out and discuss it again.
We have so many questions, which I know we're going to look at and find a way to address, but we have so many questions. We'll never get to them all, but we'll do our best. I'm going to bring in one of Melissa's colleagues, Terry Morse, who, as a supervisor, has to deal with people's concerns and fears. And well, Terry, go ahead and ask your question.
Yes, thanks, Alex and Dr. Jarrell and everyone. And Juliet may have answered part of this question. I'm not sure. But as a supervisor, I'm grappling with how to appropriately respond to staff questions when they say they're afraid to return to campus, whether or not they've been vaccinated. They are still afraid to return to campus, and they make the argument that they've been working successfully 100%, teleworking up till now. So as a supervisor, I'm trying to figure out how to deal with that. What can I say? How do I respond? And I guess it's for both time periods, from June till the fall, and then, afterwards from the fall on.
Great. That's a great question, Terry. And I actually have two answers. The first one I'm going to direct to employees. And so to employees who are grappling with anxiety and concern, I would strongly encourage you to use the resources that we have available in support, including the Employee Assistance Program. There are resources available to help you work through your concerns. For supervisors, we are hosting 2 sessions, one in May, a little later on in 2 weeks, and one in June, of open forums specifically dedicated to supervisors to help them get the answers they need, Terry, to question, just like the questions you just asked. We have other scenarios. We've heard a lot from supervisors on campus asking for assistance in helping them manage this process. And we recognize that in some respects, coming back to campus is almost more complicated than it was leaving campus over a year ago. And so we want to try to provide as many resources as we can to our supervisors and our employees. So please try to attend one of those sessions. And if you're a supervisor and you cannot attend one of those sessions, or you have very specific needs, call Human Resources, and we're happy to help you with that.
Yeah, and let me add one or two things, Juliet. The first one is, you know, at UMB, we have a School of Medicine and we have an internationally known Center for Vaccine Development. And those experts work with us, and some of them, you know, Dr. Chen, certainly a lot, to give us advice about what's safe and what's not safe. And I wouldn't be sitting here saying we're going to move back to campus in a phased manner if I didn't think it was safe. We've been through this many, many times, and we believe we have all the measures in place to protect you. And we also believe we've got this terrific track record that shows that we've done a good job of protecting. But let me also add, we are now one of the most vaccinated groups in the country. Being above 70% is a remarkable achievement. It has to do because we are a health and social justice campus, but there's been a priority put on that, and we've accomplished a lot there. So I have to say that we've really got a great track record. We've really got a great vaccinated group, and I don't know that it could be much safer to be coming back at this time. And we've hesitated to come back earlier for these reasons. So now we're in a position where it's getting a whole lot safer. It's time, I think, is what my answer would be. Alex?
I know we can't answer these things specifically, you've mentioned that, but I just want you to know there are a lot of people asking about exceptions, about, you know, one woman writes that she's feels like she's going to experience PTSD coming back to the office after being home for a year. And someone else says, you know, I'm concerned about, you know, the commute, the telecommuting keeps me calm, but if I have to use public transportation, I'm going to be, so there are lots of, we talk about medical exceptions, there's a whole array there. But I want to bring in Catherine Thornhill to ask a question about a more logistics related question. Catherine, are you there? Catherine? Yeah, go ahead.
Yes, I'm here. I just don't have my camera on. So my question.
You don't need your camera.
Okay. How do you know in advance what the capacity will be for that day? Like if you've signed up to be there on a particular day, but you need to go in to do something on a different day, like how will we know that on the day that you're there, other people aren't coming in and exceeding the capacity? And, you know, how is that monitored?
Melissa, you got any suggestions there?
I believe it's being done unit by unit, so it should be on a unit level. So for labs or for office spaces, I know for my office space and for my staff, I submitted a spreadsheet and I scheduled those that are in offices. Of course, I said 100% of our technical staff are there and they're out in the fields. But for our office staff, we're rotating in. So starting in June, there's a 50% capacity and up to an 80% starting in August. So it should be managed on your at your unit level.
Juliet, did you want to add anything there?
I was going to say the same exact thing.
Okay. And Denise, we don't want to leave you out.
I would echo exactly what Melissa had said. That's the plan. I had to submit that plan even though my unit's 100% on campus.
Gotcha.
Okay.
Okay, Alex?
Another anonymous questioner asks about the school's plans. Are they going to be made available for comment before they're finalized?
For comment.
For each school's plan. In other words, if there's a plan for, I'm not going to single out the school, any of our schools, they have a plan that they've submitted. Before that's finalized, will people be able to see it and comment on it? There are also questions about the March, I should mention the March survey. Will people get the results and be able to see that?
Juliet, you'll have to get that one.
Yes, absolutely. So the survey results from March are being digested. We got a huge response. I'm happy to report lots of great information. If you participated in the survey, you know there were a lot of open text type questions, and those just take a little longer to pull together, but we hope to be able to share some of the results of the survey very soon. I can't speak to the school's plans to communicate to their plans. I would suggest that you talk to your supervisor or your leadership ADs, AVPs about input in your respective area?
I think the question about seeing them in the schools before they're finalized is a good question. We certainly are massaging them and talking a lot about them, both at the campus level. They've been many of these ideas have been vetted before the Senates, et cetera. So I'll take that piece of advice back to our group, and we'll talk about is there a step in here that we've left out. So I think I want to say thank you for that suggestion because I don't have an answer for you as it currently stands.
I'm surprised we haven't had this question earlier, but I do have a question about mask wearing, and that are we going to have these rigorous rules for mask wearing, even outdoors? And I know now the city still mandates outdoor mask wearing, but that may change. And then there's of course the question here that someone says, if I have to wear a mask, why am I coming to the office? If it's inherently unsafe, I wouldn't have to wear a mask if it was safe, right? So if there's some lack of safety, why am I even here? So I guess first the question is about the masking on campus. Where's that going?
So as of April 29th, the mask policy was updated. So if you check our website, the new mask policy is online. It does still require masking outdoors as well as indoors and maintaining 6 foot physical distancing. The only exemption from wearing a mask, again, is if you're in your own office with a closed door or in a separate meeting room with a closed door. However, they did add the ability to take a break outside as long as you are physically distanced. If you are, sitting in the School of Nursing lawn and you're physically distanced, just taking a break, you would not need to sit there with a mask on. So you may take outdoor breaks. There is an addition to the policy that probably hasn't been publicized. And I know I just had to speak to a lot of my staff. You will no longer be able to wear gaiters or handkerchiefs as a mask. So they do not suffice as a mask on campus. And that's all I can answer on the updated mask policy.
Yeah, let me see if I can get just a little bit to your question about, well, if I got to wear a mask, it means it's not safe. First of all, COVID is not going to go away. In fact, it's not new. It's been around. COVID's not going to go away. And protecting one another in this public health measure, to me, makes sense. Second of all, if you look at what happened with influenza, and the sort of the poster child was New Zealand, where they wore masks and had no influenza, or not no, but almost no influenza cases during the year, tells you that the transmission of aerosolized type of infections was highly controlled by masking. So, COVID is not going to go away, and that doesn't mean we stop functioning. We do function. Masks have been shown, I think, to me, to be very good in terms of protecting public health. And so I think it's a way of life right now. And if you wait for COVID to go away, you're going to wait a long time because it's not going to go away. So now that's my humble opinion on all this. We certainly can get our experts to give us more detail on it. But I think what that says is COVID is at a low enough level that it is safe to be back, and masking adds an additional layer of safety to that safe to be back position. So I think that's the way I would have to answer it on the fly. Alex?
I think maybe the best way to end this, I know we're at the end of the hour, is of course, everyone's concerned about the specifics of what they're going to have to do and what they'll be allowed to do. But there are a number of people out there who are asking things about, they're echoing that sense of missing the camaraderie and the community feel of being at work. One person asked, will indoor meetings and gatherings ever be allowed? Will people be allowed to eat indoors together? And then one person writes, do you think we'll ever be 100% together on campus again?
I think I'm going to say I don't think so. I think we have fundamentally changed, and I think people have demonstrated how effective they can work in teleworking. I think that's a good thing. It's a question of extent. and making sure that the university remains a university. I think there will come a time when we'll eat again in person and have camaraderie. I gotta believe that because I think that enough of us are going to be protected with COVID that that's going to become a much safer way to do things. But don't go out and eat on my accord right now. I think we've got to still wait for even a lower level of COVID in our community. But it's really come down. And by the way, that brings up a good point. If COVID changes tomorrow, we will be looking at all these policies tomorrow because it is a changing environment. And we have experts around us who are right on top of these things. So we will pay attention to that as well. So Alex, are we out of time? So I think one other conclusion here is that we'll have more of these sessions where they're about these topics that are of interest to you. And as we evolve the telework policy, the vaccination policies, the mandate around that, et cetera, we will be back to ask questions and answer questions as they come up. So that's something we will definitely do. So I think we set a new record, Alex. We were at one point over 720 people. So great event. And thank you all for showing up to this. It really is important for us to hear from you.
Right. Take care, everyone.